Last week, we took you through the landscape of malnutrition, shocking data and numbers. If underweight and stunting affects rural India, obesity and anemia is a challenge for the urban setting. In today's episode, let's try and understand how the government's POSHAN Abhiyan and various interventions across the country are trying to tackle malnutrition. The problem of malnutrition is intergenerational and is dependent on multiple factors. Breastfeeding, optimal infant and young child feeding practices, immunization, institutional delivery, early childhood development, food fortification, deworming, access to safe drinking water and proper sanitation, and dietary diversification. In 2017, malnutrition was responsible for 2/3 of child deaths in India. Prime Minister Narendra Modi has issued a pledge that India will become free from malnutrition by 2022. Also, India would be celebrating its 75th year of independence in the year 2022. And to mark the celebration, the ministry has set an ambitious goal to make the nation malnutrition free by 2022.
I take this opportunity, sir, to inform the House through you that it is a known fact that undernutrition is an outcome of not one but multiple detrimental factors. These factors play their role in helping sustain this continuous burden of undernutrition, leading to our inability to achieve our desired human resource potential generation after generation. In order to achieve desired target and play the role as a global superpower, we need to focus on eradication of malnutrition so as to ensure that the coming generations are healthy, enabling higher intellectual potential, leading to enhanced work productivity. To address the issues of malnutrition, Ministry of Women and Child Development is implementing the following scheme. The government has set up POSHAN, Prime Minister's overarching scheme for holistic nourishment, earlier known as the National Nutrition Mission Abhiyan, on the 18th of December 2017 for a 3-year time frame commencing from 2017-18 with an overall budget of Rs 9,046 crore. To ensure a holistic approach, all 36 states, union territories and districts have been covered. The goals of POSHAN Abhiyan are to achieve improvement in nutritional status of children from 0 to 6 years, adolescent girls, pregnant women and lactating mothers in a time-bound manner during the 3 years with fixed targets.
Malnutrition remains a silent emergency in India, but one sees substantial improvement in health and well-being since the country's independence in 1947.
We have made significant progress in reducing malnutrition, but the problem is that the progress that we are making is not enough. You know, the rate at which we are making the progress is what is bothersome. With the economic status that India has today and the available resources in terms of nutrition interventions and the infrastructure we have created, we should be making a far more rapid decline in malnutrition. That is unfortunately not happening.
The POSHAN Abhiyan provides an opportunity to counter malnutrition and usher in a new era in food and nutrition security. To address the problem of stunting, underweight and wasting, especially in children, sustained efforts with multi-pronged approach, grassroots synergy and convergence is the key.
POSHAN Abhiyan, the National Nutrition Mission, aims to do is to bring in massive acceleration in decline of undernutrition in children and also to address anemia both in children as well as in women. It brings together food intervention, breastfeeding intervention, but equally importantly the interventions in the health sector, which are so very important. We can talk more about it. And it has a focus on the first 1,000 days of life, which means 9 months of pregnancy, and first 2 years of life of the child.
Unsurprisingly, the burden of malnutrition is far from being equally shared between the states and union territories. Some states have seen a higher prevalence of stunting, while others have different challenges. According to the Comprehensive National Nutrition Survey 2019 report, Bihar, Madhya Pradesh, Rajasthan and Uttar Pradesh had a high stunting prevalence, which was about 37 to 42%. A higher prevalence of stunting in under 5s was found in rural areas compared to urban areas. Also, children in the poorest wealth quintile were more likely to be stunted as compared to the richest quintile.
If you look at life expectancy, while we've achieved tremendous gains in life expectancy over the last 25 years, there is still a 10-year difference between Kerala, for example, and Assam or Uttar Pradesh. If you take mortality under the age of 5 years, so in deaths in children under 5, there's a 4-fold difference again between the most developed and the least developed states.
The NHFS 4 report shows wide interstate and inter-district variations in the prevalence of all 3 indicators of undernutrition in the country. It is necessary to identify the specific causes of undernutrition in each district and provide targeted interventions after identifying the exact causes in those areas. That is the reason Niti Aayog has selected 113 districts to bring about improvement in nutritional status in a time-bound manner, also with help of leveraging technology.
We looked at how to classify districts with low development indicators and low indicators related to health and nutrition. And stunting rates were, as well as infant mortality rate, was accounted for. Now, as a part of the Honorable Prime Minister's program, there is a special program on aspirational districts, on which the massive emphasis and the biggest emphasis is on health and nutrition. We are providing smartphones to all the Anganwadi workers. The idea of smartphones is twofold. One, use the phone, the screen, for education messages on feeding, on how to look after the child with diarrhea. But also the other purpose is to provide monitoring of the children and look at their weights. The data can be transmitted.
We know how serious the problem of malnutrition is, but there are 3 major strategies to battle malnutrition with varying levels of success. Dietary diversity is the most sustainable, long-term approach for tackling malnutrition and micronutrient deficiency. However, the availability, accessibility and affordability of different kinds of foods and diverse diets are a challenge. Supplementation. Government programs for vitamin A supplementation and iron folic acid supplementation for pregnant women and adolescent girls have been in operation for over 5 decades. Food fortification is a process by which vitamins and minerals are added to commonly consumed foods, which offers a good opportunity to improve the micronutrient status of people without changing their food habits. Keeping in mind the issue of deficiency of micronutrients, food fortification helps in adding micronutrients into foods that does not already contain them. Like milk is often fortified with additional vitamin A and D to boost its nutritional value. The aim of fortification is to help people remedy.
In metros, because of the lifestyle, children and people are not exposed to sun, and vitamin D deficiency is developed. And in rural areas, malnutrition is a major problem. And it is our collective responsibility that we fortify our food, especially milk, because milk is a very good vehicle for carrying these micronutrients. Earlier, the fat-soluble vitamin A and D were available. Now even water-soluble vitamin A and D are available. And Mother Dairy has been the pioneer, thanks to Dr. Kurian's vision. In 1984, when we started the bulk vending system, our milk was fortified by vitamin A, and we continue to fortify bulk vending token milk, which is being distributed from 1984 onwards. Recently, we have been fortifying the other variants also. I wish that all the variants can be fortified. FSSI should allow that all the milk variants can be fortified with vitamin A and D.
The Food Fortification Resource Center has taken the onus of major widespread production of fortified foods, creating an F+ logo for the staple foods like rice, wheat flour, salt, edible oil and milk.
These micronutrients, vitamins A and D, vitamin B12, iron, folic acid, they are essentials. They are like magic wand for our body. They are required in such small quantities, but do wonders with our body. So these are required by all of us in sufficient quantities, and our food systems unfortunately are not providing so. So we are promoting fortified staples: wheat, flour, rice, double fortified salt, edible oil and milk.
Implementation of any program is the key for its success. So the Swasth Bharat Prerak program is a joint initiative of the Ministry of Women and Child Development and the Tata Trust, supplements the path-breaking POSHAN Abhiyan by providing managerial and administrative support to the district and state administration for the effective implementation of the mission.
Many of these preraks are young graduates just out of college. They're very enthusiastic about this. They've been given a couple of days training. In the last 18 months or so, we have had more than 500 preraks, each working at the district level. At any given time, more than 350 districts are covered. Almost 90% of the aspiration districts are covered. They are the go-between the different departments and just help implement the very well conceived and planned implementation framework of POSHAN Abhiyan.
India is the anemic capital of the world, and 20 to 40% of maternal deaths in our country is because of anemia. Smile Foundation's Swabhiman program aims at imparting knowledge to adolescent girls and pregnant women, telling them about the right diet to eat, especially iron-rich foods. Sanju was detected anemic 6 months ago. Her hemoglobin level was 6 mg, but with intervention today, her hemoglobin is 10.
तो जब चेकअप हुआ तो इन्होंने बताया कि ये हरी सब्जियां खाना चाहिए और गुड़ चने सुबह खाना चाहिए, तो ये सब खाएं और अपना खाने पीने में सब चीज़ में दवाइयाँ भी लेती हूँ। यहाँ की दवाइयाँ मिली है। पहले चक्कर आता था, सिर में बहुत दर्द होता था, तो बहुत थकान सी हो जाती थी थोड़ा सा ही काम, अब ठीक रहती हूँ।
In the battle to eradicate malnutrition in Maharashtra, timely intervention by the nutrition program in Amravati and Nandurbar has ensured the lives of the poorest, most vulnerable and malnourished children have been saved.
Community nutrition workers which are there on ground, they try to find out the households which are at risk. They support the district administration, they support the state administration. They help taking the they do the referrals of the malnourished kids to the nutrition rehabilitation centers. They educate the moms on the role of nutrition. We have produced certain game tools like the POSHAN Thali. So these women actually who are there on ground as the nutrition volunteers with us, they just don't promote the nutrition part, they work a lot on the lactation part also.
Sukhmani Bhilavekar is happy that her son now has the energy to play. The initial few months after pregnancy was a huge challenge as the baby was born underweight. As the little one gets playful, community nutrition workers say they would have lost the child perhaps had it not been the continued effort to push the mother and child towards healthcare centers.
एनआरसी में जो बच्चों को जो फैमिली भेजते नहीं है ना, उन्हें हम फॉलो अप करते हैं और जो बच्चे एनआरसी से लौट कर आते हैं उन्हें हम 6 महीने तक के म्हणजे फॉलो अप करते हैं। जैसे कि उनके घर में जाकर 15 दिन में एक बार बताते हैं कि घर की साफ सफाई कैसी रखनी चाहिए और खाना खाने से पहले हाथ कैसे धोना चाहिए, फिर फिर शौच में जाने से बाद में फिर हाथ धोना चाहिए और घर का वातावरण कैसे रहना चाहिए।
Hemlata is one of the unsung champions, also called nutrition champions, at Nardan Basti, Lal Kuan in the capital, who is dedicating her life to serving other women like Geeta and their young children to help improve their health. Geeta's 5th born child, Vedant's weight at birth was 1.40 kg. He was admitted in the ICU, a reason being premature delivery and mother's ill health.
एकदम छोटा था, इसका मुंह बहुत छोटा था, 1 हफ्ता तक रहा, आईसीयू में रखा था और मेरी छुट्टी दे रही थी। डबल ऑपरेशन पे हुआ था। ये परेशानी हो गई थी ना, मेरे बीपी भी था और शुगर भी था, तो उसकी वजह से ऑपरेशन करना पड़ा। तो मेरी छुट्टी रह रही तीसरे दिन ये 1 हफ्ता तक रखा था। और खाने पीने का यही जैसे 6 महीने तक तो कुछ नहीं बताया, पानी भी नहीं बताया, भाई दूध ही पिलाओ। और 6 महीने के बाद बोला है कि जैसे दलिया खिला सकते हैं, खिचड़ी खिला दो, संतरा सेब, जैसे दूध मीट के भी खिला सकते हो सेब, और जैसे उबाल लो हल्की सी, उबाल के और दूध मिला के खिला दो उसे। हाँ, डॉक्टर के पास ले गए थे तो उन्होंने बोला था सही है, इसकी देखभाल करो, जैसे खाने पीने को ध्यान दो इसका।
होम विजिट पे जाते हैं तो मदर्स हमें पता चलता है कि ये मदर्स प्रेग्नेंट है, तो हम रेगुलरली उनका होम विजिट करते हैं, उनको अपनी फीडिंग के लिए बताते हैं कि उनको क्या क्या खाना है, कैसे खाना है, कितना आराम करना है, इंजेक्शंस कब कब लगाने हैं। तो उसके बाद में जब डिलीवरी हो जाती है देन बच्चे को जाके बच्चे की फीडिंग कराते हैं, उनका चेकअप करते हैं, बच्चों का वेट कराते हैं और डिस्पेंसरी भी रेफर करते हैं अगर बच्चों को ज़रूरत होती है। कम्युनिटी में जैसे जो लेडीज़ अपने बच्चों को अच्छा बना चुकी हैं, मतलब मैलन्यूट्रिशन से बाहर निकाल चुकी हैं, उन्हीं लेडीज़ का उदाहरण देके हम बाकी लेडीज़ को बताते हैं कि उनको समझाते हैं कि ये लेडीज़ भी अपने बच्चों को अच्छा बना चुकी हैं, तो आप क्यों नहीं बना सकते।
The Integrated Child Development Services program was started by the Indian government in 1975 to combat child hunger and malnutrition. Today, there are more than 1.3 million Anganwadi centers spread across the country that deliver early education, health and nutrition services as part of the scheme. Perhaps the largest mother and child nutrition and care program of its kind in the world. Another initiative is the midday meal scheme. It aims to improve attendance and retention by providing free food in government and local primary schools, but often quality of food is compromised.
होता क्या है कि जो मिड डे मील है, आंगनबाड़ी है, SC ST का हॉस्टल्स है, लड़कियों का हॉस्टल्स है, उसमें हमने कहा कि जो कहते हैं कि अलग अलग डिपार्टमेंट हैं, हम देते हैं, लेकिन डिपार्टमेंट कोई महिला का है, कोई SC ST का है, उनसे भी हमने कहा है कि कम से कम जो बच्चे पढ़ते हैं तो जो वेजिटेरियन है उनको दूध दे दो, जो नॉन वेजिटेरियन है कम से कम 2 अंडा दे दो। लेकिन जहाँ चावल का जब मामला है, इसको हम बहुत जल्दी क्या कहते हैं कि इसको लेकर के हम कैबिनेट में जाएंगे और क्या कहते हैं कि हम चाहेंगे कि जो भी गरीब लोग हैं जिनको ये जो अनाज मिलता है वो पौष्टिकता के साथ मिले।
Though we have healthcare programs and policies, but what are the missing linkages? Or is implementation a cause for concern? There are many success stories of various state governments that can also be replicated across the country.
There are many gold models in India, gold mines of impact models in India. So there are many states which have shown tremendous results. So if some states in India have shown anemia reduction, if some states have shown on stunting or underweight reduction, why not if you put our effort and best practices, why not India cannot achieve?
To achieve malnutrition-free status, India's development agenda needs to tackle the double burden of malnutrition, that's undernutrition and obesity at the same time. The POSHAN Abhiyan needs to become a Jan Andolan. People need to be aware about nutrition and making the right choices. It's important that as citizens we take responsibility to work with all stakeholders to make India a truly healthy country.